how you feel about today. Certainly historic moment.
It's an incredibly historic moment. We are delivering free birth control and free diabetes medication and devices for every Canadian everywhere in this country. That's what we rolled out today. This is something we've long fought for. You Democrats have fought for this since our party began. The Liberals promised it for 30 years, but broke that promise every year. And it is no coincidence that it is happening now when we have forced them to do so. Today is also the 3-year anniversary, almost to the day when we first tabled pharmacare legislation in this very parliament, and this very same Liberal government voted against it. And now we're getting it introduced this time. So it's very historic. It's going to mean a huge difference in people's lives. And we're proud to be able to save people money, but also improve our healthcare.
Were you really going to pull support from the Liberals if they didn't move forward with this today?
Oh, without a doubt. I think that's a big reason why we got to this point. We were very firm, and we said that we expected not just the legal framework that we negotiated, but we also wanted some concrete coverage. And we wanted to see concrete coverage for birth control and for diabetes medicine and devices. And we were very strong on this. We made it very clear what we expected. We held the line, we fought hard, and we won.
But is it enough? There are some people who are saying it's 2 items, diabetes, contraceptives, not what they would have hoped for. They would have wanted more. What are your thoughts on that?
Well, this is far and above what we had actually written down on paper. What we had forced the government to agree to was just initially the legal framework. So just passing a law. What we got instead is not just a law, but 2 concrete medication classes covered. So it's going to mean for a young woman that needs to get contraceptives for many reasons. Sometimes it's birth control is prescribed because of a medical condition. They can go in and have that power to control their own bodies and be able to get that birth control that they've been prescribed that they need. And it will give them control over their own bodies. For people living with diabetes, this means they don't have to worry if they have the right insurance plan or not. This means they can go into a pharmacy and get not just the insulin and diabetes medication, but the glucose monitoring device or the pump that they need to stay healthy. This is going to be life-changing for millions of Canadians, and it is a universal single-payer program. So everyone in a province that signs on is going to get this. So everyone that's living with diabetes, type 1 or type 2, everyone that needs access to birth control will be able to get it wherever we get this signed into in provinces.
Well, Hamilton, of course, has a long history of having huge NDP support. What do you say to Hamiltonians about how they are supposed to feel about this and what the NDP is doing for this area that has such strong support for NDP?
I would say a huge thank you to Hamilton. We wouldn't be there. We wouldn't be here without you. Hamilton has long supported New Democrats. And the only reason we're in this position is because of all the people across the country who supported the work that we did that got us to this point. The volunteers, the activists, the progressives, the health coalitions, the New Democrats that got us to this moment where we have now delivered a historic expansion of our healthcare system. This is the most national pharmacare we've ever seen in our country. And this is one of the biggest expansions of our healthcare system since we began.
There has been hesitation from some of the provinces, though. Alberta, for one, Ontario, still not quite 100% there. What do you say to the provinces who are saying, hey, we want to manage our own healthcare costs and system?
Well, for the Conservative premiers that are coming out opposed, like Danielle Smith, I'm not surprised. Danielle Smith doesn't even believe in public healthcare, doesn't believe in universal healthcare, period. She wants to do away with it. So I'm not surprised that she's going to say no to a plan that would cover every single person living in Alberta who needs access to diabetes medication. The fact that she would say no to that is just another example of how she wants to cut the things that people need, as Conservatives do. What we want to do is make sure someone in Alberta and in Ontario, wherever they live, get access to diabetes medication. It's going to be up to those premiers to defend their bad decision, I think, of saying, no, we're not going to cover you. I think what's even worse is when asked about this, Pierre Poilievre, leader of the Conservative Party, said that it's not worth it. to cover people who are dealing with diabetes. It's not worth it for women to be able to have control over their own bodies by getting access to birth control. He says those people are not worth it. I reject that. People are worth it. They deserve a plan like ours where their medication is covered. I believe in that. I'm going to fight for that.
Well, this is a pretty big win for you. So what comes next? I mean, what tops this for you on your agenda?
It's I don't want to make this about myself because it's really about the people. And I think what I've been trying to focus on is remembering this young boy that I met with his parents. I believe it was his dad. And it was when I newly became a leader at the national level. And it was back when we were in the center block, so a building that's now been going to be shut down for over a decade. But it was when we were still in that building, and I remember having a meeting in my office. And the young boy was telling me about he had type 1 diabetes and he's got to take all these different medications, injections, blood work. And I said, well, what's that like? And he said, oh, I'm not worried about it. And he was really mature beyond his years. He said, oh, I'm fine with that. What I'm worried about is how much all of my medication is costing my parents. And for this young boy to not be worried about this life-threatening illness, this permanent illness, incurable illness, he was instead worried about the cost. I remember telling that boy, hey, you know what? I'm going to fight for you. I hope the boy is watching today the news, or his parents will let him know that we made that happen. To that young boy who's worried about how much his medication costs his parents, you don't have to worry anymore. And so I'm going to think about that and focus about who this is going to help. Make sure this gets rolled out properly. Watch it very carefully, and then we're going to keep on fighting for more. Canadians need a lot of help. Hamiltonians need lots of relief from the pressure that they're feeling from the high cost of groceries and housing, mortgage, rent. So we're going to work on those things as well.
So what then, not for you as an individual, what next for the NDP having such a success in this?
Well, there's lots of work that we need to continue doing. We've got to make sure that this rolls out. So we're going to watch it closely. We're going to put pressure on the government to sign deals with provinces as quickly as possible. So that's the next big step. There are provinces that have indicated positivity or an openness to it. So we want to see those projects or those agreements move forward quickly. So really, it's going to be about pushing to make sure this is in people's hands, that people can actually see the benefit. We want that to happen as quick as possible.